As Pete and Laura and Peter and I have talked about this session, I think one of the first things we want to mention is that while the final rule for Guidance 213 is out, there is still a lot of room for interpretation, and we're working closely with FDA to try to get some of the specifics ironed out as they write their compliance guidance documents. So just to give you a little bit on Guidance 213 and the VFD rule, I'm sure that unless you've been under a rock, you know that this has happened and is happening. But basically what happened is Guidance 213, and when FDA writes a guidance, it is their current thinking on a topic, but it is often interpreted as regulation, and the agency will follow a guidance document as if it is a regulatory strategy for them. Guidance 213 was finalized in 2014, and the final VFD rule was issued on June 2nd of this year. And all of the manufacturers or sponsor companies that have medically important antibiotics have agreed to comply with Guidance 213 in a voluntary manner. What that means is that growth promotion or improvement in nutritional efficiency labels for the drugs that are considered medically important will be removed by 2016, and that disease prevention, disease control, and disease treatment, which FDA considers to be therapeutic, that those uses will have to be either a VFD for delivery in feed or a prescription for delivery in water. Right now, and this is a question I don't have on here, or a point I have on here, medically important OTC injectables, such as, let's say, Pen-G well, Pen-G is a great example. It's an OTC injectable right now. Will stay an OTC injectable during this transition. My expectation is FDA will, over the next few years, and not very many years, move those into an RX status as well. But for right now, we're talking just feed and water medications. So what's affected? Basically everything you use in feed, in water, except for these drugs, and that's bacitracin, carbadox, bambermycin, which is flavomycin, ionophores, which is schisis, tiamulin, which is Denagard. Those are considered not medically important by FDA. I've got a couple asterisks by those that are products that are considered medically important by WHO but not by FDA. They will not be affected by Guidance 213 and VFD. Some of our restaurants and retailers may be looking at the WHO list instead of the FDA list. But for the purposes of this discussion, for FDA regulation, these are the 5 feed-delivered antibiotics that are not medically important, that will still be available OTC, and will still be available for use as a growth promotion if it's on their current label. We've been working on this as an industry for several years. As we've known, it's been coming, and really spent a lot of time trying to negotiate with FDA. Had the entire barnyard, which would be chickens, turkeys, milk, and beef, meeting with FDA. Had veterinarians and producers coming in. Pete's been in a couple times to talk to FDA with us. Worked really hard, FDA, as they were putting the rule together. Had listening sessions throughout the country, and we worked with Pork Board and ASV and ourselves to make sure we had producers or swine veterinarians at every session, whether it was in Washington State or Tennessee or wherever. They might not be big pig populations there, but we wanted to make sure the pig industry was heard. And our goal was to make the VFD process more workable. I felt until the final rule was written that we probably had succeeded. Now I've got some doubts about how effective we were, and we're going to have to go back and really work on clarifying some of the issues in that final rule. Obviously, the Pork Board and as well as ASV members are going to need to take the effort to initiative to especially do outreach to producers, and through fora such as this, educate veterinarians as well. The other thing, obviously, that we want to do is avoid things like out-of-feed situations, because a producer can't get the medicated feed they need, the feed mill won't deliver. Also, this last bullet point for me is code for saying FDA will look for regulatory in enforcement actions that they can take. They're very serious that this rule is considered a significant step, that it's not a voluntary, producers can or cannot follow it. It is not voluntary for producers to use these drugs extra labels, so thus when the labels are changed for producers, you are compelled to follow the label in feed. So here's what's changed. In the previous rule that covered pulmotil and fluorophenocal, you had a 2-year record retention. That stayed the same. You needed to take the original document to the feed mill, and with this rule you can either email, fax, or of course take the original document to the feed mill. The producer, the feed mill, and the veterinarian all need to retain a copy. There's still no extra label use in feed. You used to have to order for the number of tons of feed you wanted on the previous VFD. Now you can order for the number of days. And so that's going to make math a little bit easier. There will be no refills unless it's on the label. However, there are no medicated feed products that are labeled for refills. And so at this point in time, unless FDA changes some or allows some label changes, there are no official refills. They do have this little caveat in the rule where they talk about, or in the discussion around the rule, it's not actually even in the rule, it's in their discussion document, where they talk about standing orders. As we were negotiating with FDA, we believed that standing order could be filled multiple times during a 6-month period. In the discussion around it, they've talked about it as a kind of a one and done. In subsequent discussions with FDA, they've talked about multiple uses of that standing order. So I think this is one of the points where it's just we're going to keep working to try to get you the answers. We don't have the answer today. So a standing order can be written to be utilized at some time during the 6 months. We just don't know yet if it's only utilized once or multiple times. We do know that you can write it for multiple premises on one VFD, so that as long as you have a mill feeding multiple premises, that you can attach a list of premises for each mill. There will be a VCPR required. They will use your state's definition, so each state may have a little different definition. If your state doesn't have a definition of VCPR, it'll revert back to the federal definition in the AMDUCA rule, and a maximum of 6-month expiration. So that's kind of the summary of what changed. What we think is going to happen with producers with the impact is we were especially concerned that producers that were manufacturing feed on farm would have to register as a distributor. If they're buying medicated premix, the type B premix, they will not need to register as a distributor, but they will need a VFD to be able to buy the medicated premix. So that's one step of paperwork that producers won't need to do if they're feeding or manufacturing feed on farm. We have been told that if you get to the end of your 6 months, you have medicated feed in your bins, that is not allowed. You can't have medicated feed in front of animals in the absence of a valid VFD. So that's something we're going to have to watch as you get to the end of those to make sure that you've got a valid VFD when you have medicated feeds in your bins. We think the most likely impact to producers is going to be to our small producers. There's always going to be a cost, of course. You're going to have veterinary costs for the visits and to get VFDs, the time to write VFDs, distributed across a much smaller number of animals. But also if you're a producer who's not buying floor stock or buying a minimum number of tons of feeds, you may have feed mills who are not going to make those small quantities of feed. They may not want to deal with floor stock. Your farm and fleet that a 4-H kid might go to pick up floor stock may choose not to have to deal with the paperwork. So I think really the impact is going to be to our smallest producers. We're still working with the feed mills. I think that's going to be, and Laura and Pete and I talked a little bit about that, something as veterinarians you may want to make sure you sit down with the feed mills that work with your farmers to see their interpretation, to understand what they're going to require, because there's enough gray areas in the rule that they may choose to interpret it a little differently than we do. Again, standing orders are still up in the air. We have been told that if you have right for premises at, let's say, a nursery and it fills 4 times in 6 months, that you should be able to have one VFD that covers each group of animals coming in, just like the feedlot cattle. I've been concerned about that as well. That's not written in a compliance guidance yet, so we have to be on top of that. Very uncertain what the interpretation of pulse dosing is going to be. That should be pulse dosing, question mark, question mark, question mark, because it could be that they may consider that each one would be require a new VFD. So in summary, one of the things that's going to happen is we feel that the label changes will all take place probably the last quarter of 2016. So really changes won't be felt on the farm or in your clinics much before then. The new VFD rule that was finalized in June did apply to the 2 products we currently have, but it's not going to apply to other products until the label's actually changed. Label changes are required by the end of next year. FDA tells us they're on track to be done by then. And there is some uncertainty on how many sponsors will change the labels, or some may just choose to stop manufacturing low-profit products that are either old or generics or are not worth spending the regulatory time to change. So the next steps, FDA has acknowledged that treatment, control, and prevention are essential for protecting animal health and controlling disease in food-producing animals. However, the agency has been actively engaging stakeholders, and this is right from their question and answer document they put out with the rule, to express their position that medically important antibiotics labeled for continuous or undefined duration of use is not consistent with judicious use principles. The agency always hauls out the idea of tylosin being used for liver abscesses in animal or in feedlots, but I think we run a risk that some continuous use antibiotics, if they're long uses, may be at risk in the pig industry. And so FDA believes it's important that appropriately targeted uses to targeted animals at risk for a specific disease and a limited duration and risk-based use. So I think that's the next step the agency is looking at, trying to define prevention. It's gotten a lot of press from the advocacy groups. Pork Board, NPPC, and ASV have had a task force that identified prevention as a major area to protect, trying to identify which products could be at risk. And also ASV is working with AABP and the avian pathologists to try to put together some document that might define when prevention is appropriate. We continue to work with FDA to reinforce that prevention is absolutely necessary. And of course, USDA ARS is doing research. So in conclusion, it's going to really require collaborative effort to implement this rule and have minimum disruption. So veterinarians, producers are essential. Feed manufacturers are going to be a huge part of this issue, or getting this implemented. Our sponsor companies as well as FDA. Compliance guidance, which is kind of the rule book that FDA will write for their inspectors, is under construction. We're trying to be out there to make sure we understand what they're putting in there. And final, I think by January 2017, it could get either really interesting by then. So